Welcome to the product training video for Allstate Health Access, fixed benefit plans that offer your customers an easy and affordable way to pay for everyday healthcare. In this video, we will introduce you to our fixed benefit indemnity product, Allstate Health Access, and discuss why your customers may want to enroll in it. We'll cover available plan design options, discuss the Recuro health benefits that are available for your customers to add for even greater savings, and review how the plan works. We'll also cover its plan details, including eligibility and state availability. Finally, we'll let you know about some resources that Allstate Health Solutions makes available to you as an agent, and resources for your customers as well. Why might your customers want to purchase a fixed benefit indemnity plan? 64% of Americans have reported that they avoid or delay necessary treatment due to medical costs, and, as such, many would appreciate more money to help pay these costs. 44% of Americans do not visit a doctor when they are sick or injured because they do not know how much the visit will truly cost them. Additionally, 41% of Americans have problems with medical bills or debt due to their high healthcare costs. Fixed benefit indemnity plans are often an affordable way for customers to get the health care they actually need. These plans help to cover the anticipated costs of everyday healthcare services by paying set dollar amounts for certain covered healthcare services. Customers pay anything in excess of their plan benefits. Life is full of what-ifs, but when it comes to your healthcare, questions like, what if I get sick and injured? Or what if I have unexpected costs, can leave your customers wondering if they have the right amount of coverage. Allstate Health Access is fixed benefit insurance that helps your customers cover the what-ifs that they encounter with their everyday health care. Plans give customers an affordable and predictable way to pay for things like checkups, prescriptions, lab tests, and more. Allstate Health Access is most effective when used in combination with a major medical plan. However, it can also serve as minimum coverage when major medical is not an affordable option, allowing your customers to get coverage at a cost that works for them. Allstate Health Access provides customers with benefits in every plan. All Health Access plans offer predictable, set payments and premium rates. As a result, your customers will know exactly what their plan will pay for office visits, lab tests, hospitalization, and more. Plus, their premium rates are guaranteed for 3 years on all plans. Health Access plans also include immediate benefits for injury and sickness, while preventive care benefits have a short 90-day waiting period. Furthermore, Allstate Health Access plans not only offer coverage for adults 65 years of age and younger, but child-only plans are also available. Finally, Health Access plans have no lifetime maximum. The maximum benefit amount is paid every year your customer owns their plan for life. Allstate Health Access is a great option for your customers who cannot afford major medical plans, want help covering costs that other plans do not cover, or may need help paying for healthcare expenses. However, Health Access is not suitable for customers who utilize a lot of medical services, or need ACA coverage, or want comprehensive medical coverage. Health Access is also not suitable for those who suffer from a serious illness or chronic condition, or those who are eligible for an ACA plan subsidy. Now, let's review the available Allstate Health Access plan designs. We'll cover plan benefits, as well as discuss the First Health Network. Your customers can choose from 4 available Allstate Health Access plan designs. Metal Gap, Core, and Plus are standard issue plans, and there is also a guaranteed issue plan. For inpatient hospitalization benefits, starting with the fixed benefit for hospital admission, the Metal Gap plan pays $6,000 per admission for a maximum benefit of 1 admission per plan year. The Core plan pays $2,000 per admission for a maximum benefit of 2 admissions per plan year. The Plus plan also pays $2,000 per admission, but for a maximum benefit of 3 admissions per plan year. On the guaranteed issue plan, the fixed benefit for hospital admission is $500 once per plan year. If your customer is confined to the intensive care unit due to sickness, the Metal Gap plan pays $100 per day of confinement for a maximum benefit of 60 days per plan year. The Core plan pays $5,000 per day of confinement for a maximum benefit of 60 days per plan year. The Plus plan pays $6,000 per day of confinement for a maximum benefit of 60 days per plan year. The Guaranteed Issue plan pays $2,000 per day of confinement for a maximum benefit of 60 days per plan year. On the Metal Gap, Core, and Plus plans, the benefits for confinement in the ICU due to an injury are identical to the ICU sickness benefits. However, the Guaranteed Issue plan pays $4,000 per day of confinement in the ICU due to injury for a maximum benefit of 60 days per plan year. Health Access members also receive benefits for healthcare practitioner visits during inpatient hospitalization. The Metal Gap plan pays $100 per visit during confinement for a maximum benefit of 5 visits per plan year. The Core plan pays $100 per visit during confinement for a maximum benefit of 10 visits per plan year. The Plus plan pays $150 per visit during confinement for a maximum benefit of 10 visits per plan year. Finally, the Guaranteed Issue plan pays $50 per visit during confinement once per plan year. If your customer is hospitalized due to a sickness, the Metal Gap plan pays $100 per day of confinement, the Core plan pays $3,000 per day of confinement, and the Plus plan pays $4,000 per day of confinement. You'll notice that all 3 plans have no limit on the number of days that your customers can use this benefit per plan year. On the Guaranteed Issue plan, the benefit amount paid per day of sickness confinement increases each consecutive year that your customer owns the plan for up to 3 years. The Guaranteed Issue plan pays $1,000 per day of confinement in year 1, $1,250 per day of confinement in year 2, and $1,500 per day of confinement in year 3. The Guaranteed Issue plan has a maximum benefit of 90 days per plan year. If your customer is hospitalized due to injury, the Metal Gap plan again pays $100 per day of confinement with no maximum benefit per plan year. On the Core, Plus, and Guaranteed Issue plans, the benefit amount paid for hospitalization due to an injury increases each consecutive year that your customer owns their plan for up to 3 years. The Core plan pays $4,000 per day of confinement in year 1, $6,000 per day of confinement in year 2, and $8,000 per day of confinement in year 3. The Plus plan pays $6,000 per day of confinement in year 1, $9,000 per day of confinement in year 2, and $12,000 per day of confinement in year 3. As with sickness benefits, both plans have no limit on the number of days that your customers can use this benefit per plan year. The Guaranteed Issue plan pays $2,000 per day of confinement in year 1, $2,500 per day of confinement in year 2, and $3,000 per day of confinement in year 3 for a maximum benefit of 90 days per plan year. Allstate Health Access plans also provide surgery benefits. These benefits are divided into Tier 1, Tier 2, and outpatient surgeries. Benefits for Tier 2 and outpatient surgeries are slightly lower than those for Tier 1 surgeries. For the Tier 1 surgeon benefits, the Metal Gap plan pays $8,000 per surgery for a maximum benefit of 2 surgeries per plan year. The Core plan pays $9,000 per surgery for a maximum benefit of 3 surgeries per plan year. The Plus plan pays $10,000 per surgery for a maximum benefit of 4 surgeries per plan year. The Guaranteed Issue plan pays $5,000 per surgery for an unlimited number of surgeries per plan year. For Tier 2 surgeon benefits, the Metal Gap plan pays $3,000 per surgery for a maximum benefit of 2 surgeries per plan year. The Core plan pays $4,000 per surgery for a maximum benefit of 3 surgeries per plan year. The Plus plan pays $5,000 per surgery for a maximum benefit of 4 surgeries per plan year. The Guaranteed Issue plan pays $1,000 per surgery for an unlimited number of surgeries per plan year. For outpatient surgeon benefits, The Metal Gap plan pays $3,000 per surgery for a maximum benefit of 2 surgeries per plan year. The Core plan pays $4,000 per surgery for a maximum benefit of 2 surgeries per plan year. The Plus plan pays $5,000 per surgery for a maximum benefit of 3 surgeries per plan year. Finally, the Guaranteed Issue plan pays $1,000 per surgery, again for an unlimited number of surgeries per plan year. The Health Access Metal Gap, Core, and Plus plans offer assistant surgeon benefits for Tier 1, Tier 2, and outpatient surgeries. The Metal Gap plan pays $2,500 per Tier 1 surgery, $1,000 per Tier 2 surgery, and $1,000 per outpatient surgery, each for a maximum benefit of 2 surgeries per plan year. The Core plan pays $4,500 per Tier 1 surgery and $2,000 per Tier 2 surgery, each for a maximum benefit of 3 surgeries per plan year. For outpatient assistant surgeon benefits, the Core plan pays $1,500 per surgery for a maximum benefit of 2 surgeries per plan year. The Plus plan pays $5,000 per Tier 1 surgery and $3,000 per Tier 2 surgery, each for a maximum benefit of 4 surgeries per plan year. The Plus plan pays $2,000 per outpatient surgery for a maximum benefit of 3 surgeries per plan year. The Metal Gap, Core, and Plus plans also offer anesthesia benefits. As with the other surgery benefits, the anesthesia benefits are divided into Tier 1, Tier 2, and outpatient surgeries. The Metal Gap plan pays $1,000 per Tier 1 surgery, $500 per Tier 2 surgery, and $250 per outpatient surgery. The maximum benefit for Tier 1, Tier 2, and outpatient anesthesia is 2 surgeries per plan year. The Core plan pays $1,500 per Tier 1 surgery and $750 per Tier 2 surgery. The maximum benefit for both Tier 1 and Tier 2 anesthesia is 3 surgeries per plan year. For outpatient anesthesia, the Core plan pays $500 per surgery for a maximum benefit of 2 surgeries per plan year. The Plus plan pays $2,000 per Tier 1 surgery and $1,000 per Tier 2 surgery. The maximum benefit for both Tier 1 and Tier 2 anesthesia is 4 surgeries per plan year. For outpatient anesthesia, the Plus plan pays $1,000 per surgery for a maximum benefit of 3 surgeries per plan year. Finally, the Metal Gap, Core, and Plus plans offer benefits for outpatient surgical facilities. The Metal Gap and Core plans pay $500 per surgery for a maximum benefit of 2 surgeries per plan year, while the Plus plan pays $500 per surgery for a maximum benefit of 3 surgeries per plan year. All 4 Allstate Health Access plans offer fixed benefits for outpatient office visits. The Metal Gap plan pays $100 per office visit for a maximum benefit of 4 visits per plan year. The Core plan pays $150 per office visit for a maximum benefit of 7 visits per plan year. The Plus plan pays $175 per office visit for a maximum benefit of 10 visits per plan year. The Guaranteed Issue plan pays $75 per office visit for a maximum benefit of 2 visits per plan year. Only the Core and Plus plans include benefits for preventive office visits. The Core plan pays $150 per visit, and the Plus plan pays $200 per visit. Both plans have a maximum benefit of 2 preventive visits per plan year. Additionally, urgent care benefits are available on all plans, except for the Guaranteed Issue plan. The Metal Gap plan pays $200 per visit for a maximum benefit of 2 visits per plan year. The Core plan pays $150 per visit for a maximum benefit of 3 visits per plan year. Finally, the Plus plan pays $200 per visit for a maximum benefit of 4 visits per plan year. The Core, Plus, and Guaranteed Issue plans all include benefits for testing services. For radiology, the Core plan pays $100 per test, and the Plus plan pays $125 per test. Each plan has a maximum benefit of 5 tests per plan year. The guaranteed issue plan pays $200 for one test per plan year. For laboratory services, both the Core and Plus plans pay $35 per test. The Core plan has a maximum benefit of 7 tests per plan year, while the Plus plan has a maximum benefit of 10 tests per plan year. The guaranteed issue plan pays $75 for one test per plan year. Only the Core and Plus plans provide customers with outpatient chemotherapy and radiation therapy benefits. The Core plan pays $3,000 per month, while the Plus plan pays $4,000 per month. The Metal Gap, Core, and Plus plans also offer observation unit benefits. Each plan pays $1,500 per day. The Metal Gap and Core plans both have a maximum benefit of 1 day per plan year, while the Plus plan has a maximum benefit of 2 days per plan year. Allstate Health Access plans also include benefits for emergency services. For ground ambulance, the Metal Gap, Core, and Plus plans all pay $1,000 per trip. The Metal Gap plan has a maximum benefit of 1 trip per plan year. The Core plan has a maximum benefit of 2 trips per plan year, and the Plus plan has a maximum benefit of 3 trips per plan year. The guaranteed issue plan pays $500 for 1 trip per plan year. For air ambulance, the Metal Gap, Core, and Plus plans all pay $25,000 for 1 trip per plan year. The guaranteed issue plan pays $1,000 for 1 trip per plan year. Finally, the Metal Gap plan pays $250 for 1 emergency room visit per plan year. Both the Core and Plus plans pay $300 per emergency room visit. The Core plan has a maximum benefit of 2 visits per plan year, while the Plus plan has a maximum benefit of 3 visits per plan year. Allstate Health Access uses the First Health Network, which has over 5,100 hospitals and 110,000 ancillary facilities. With 695,000 professional providers, 96% of the U.S. population has access to a First Health provider within 20 miles. Additionally, discounts for in-network care range from 30% to 50%. Let's discuss the optional Recuro Health services that your customers can add on to their Allstate Health Access plans. Your customers can save even more money when they add new optional Recuro Health services to their Allstate Health Access plan. Recuro Health provides customers with 3 valuable benefits: a prescription benefit, a virtual urgent care benefit, and a virtual behavioral health benefit. It is important to note, however, that Recuro Health services are not insurance. Recuro Health's prescription benefit includes a $0 copay for chronic conditions and urgent care medications. This benefit uses a national pharmacy network that is accepted at over 65,000 retail pharmacy locations across the U.S. Furthermore, it has an extensive list of prescriptions, which includes 95% of the top 800 most prescribed maintenance medications. Members will have access to an easy-to-use portal through which they can access their digital prescription benefit card and request medication delivery. Recuro Health's virtual urgent care benefit provides customers with unlimited, 24/7 access to urgent care doctors, all from the convenience of their mobile device or computer. With $0 out-of-pocket costs, this benefit helps ensure your customers get quality care when they need it. Customers will be able to connect with board-certified urgent care doctors who are equipped to treat many common concerns. Additionally, Recuro Health ensures that their urgent care physicians can easily transfer visit information to a customer's primary care physician for seamless care. Recuro Health's virtual behavioral health benefit provides customers with comprehensive behavioral health care, from therapy and counseling to psychiatry and medication management. Recuro's virtual behavioral health visits can be used to treat a variety of conditions, including ADHD, anxiety, depression, and more. Most virtual behavioral visits are available within 48 hours. Furthermore, most virtual behavioral health visits, excluding psychiatric visits, have a $0 copay. Initial psychiatric visits have a $260 copay, and follow-up psychiatric visits have a $140 copay. Let's now review how Allstate Health Access plans work, discuss additional coverage options that are available to your customers, and cover life association membership benefits. Like many other insurance plans, Allstate Health Access members should always use the network website, currently shown on the screen, to search for network providers prior to receiving any treatment. Members will first schedule appointments with providers and then present their Health Access ID card when checking in for these appointments. After receiving treatment, Health Access members will receive an explanation of benefits, which will show their network discount and the benefits paid. Keep in mind that the insured is responsible for paying any remaining balances after the plan benefits are paid. Health Access members receive the same plan fixed benefit amounts regardless of where they receive care or how much the provider charges. Let's look at an example of how Allstate Health Access can help your customer with everyday healthcare costs. Leslie has a preventive office visit, during which her doctor ordered a standard lipid panel laboratory test. Leslie has an Allstate Health Access Plus plan. The cost of Leslie's medical care totaled $426. She received a $158 discount for seeing a doctor in the First Health Network, bringing her total treatment cost down to $268. Leslie's Health Access Plus plan paid a preventive office visit benefit of $200 and a laboratory benefit of $35. As a result, Leslie's total out-of-pocket cost was only $33. 92% of Leslie's medical cost was discounted or paid for. Let's review another example of how an Allstate Health Access plan can help your customers with unexpected medical costs. While Michael was out walking his dog, he fell and tore his rotator cuff. Unfortunately, he needs surgery to repair it. He has an Allstate Health Access Core plan. The cost for Michael's surgery totaled $19,500. He received a First Health Network discount of $10,140, bringing his cost down to $9,360. Michael's Health Access Core plan paid him a $4,000 surgery benefit, a $1,500 assistant surgeon benefit, a $500 anesthesia benefit, and a $500 ambulatory surgical center benefit. These fixed benefits brought Michael's total out-of-pocket cost for his $19,500 surgery down to a much more manageable $2,860. 85% of Michael's treatment was discounted or paid for. Finally, let's review one more example of how an Allstate Health Access plan can work on behalf of your customers. Daniel was admitted to the hospital for 3 days with pneumonia. He has an Allstate Health Access Plus plan. The cost of Daniel's 3-day stay in the hospital came to a total of $30,000. Daniel received a $12,000 discount for using a First Health Network hospital, bringing his costs down to $18,000. Daniel's Health Access Plus plan paid him the following benefit amounts: $2,000 for hospital admission, $12,000 for 3 days of sickness confinement, $125 for radiology, $105 for laboratory, and $450 for inpatient physician visits. These fixed benefits, combined with the network discount, bring Daniel's total out-of-pocket costs down to $3,320. More than 88% of Daniel's treatment was discounted or paid for. Allstate Health Solutions knows how unpredictable life can be. That is why we make it easy for your customers to add on additional supplemental plans for even greater coverage and financial protection. Specified Care is a straightforward, easy-to-use plan that offers your customers coverage for many first-ever critical medical events and any subsequent diagnoses of the same critical condition. Designed as the perfect sidekick to Allstate Health Access, Specified Care can only be sold with fixed benefit plans. There are 4 available deductible options for your customers to choose from, so they can find the right plan for their needs and budget. Specified Care uses episodic deductibles, so your customers will not have to worry about their deductible resetting at the first of every year. Finally, specified care plans include a $250,000 maximum per episode. In addition to specified care, Allstate Health Solutions has many other additional coverage options to choose from. Plan Enhancer provides customers with accident medical expense coverage and includes optional cancer and heart stroke and/or sickness hospitalization riders. TrioMed combines accident medical expense, critical illness, and accidental death and dismemberment coverage all into one simple and easy-to-use plan. AxioMed combines accident medical expense and accidental death and dismemberment coverage into one plan. We also offer hospital expense protection, cancer and heart stroke, and critical illness, term life coverage. Select dental or dental indemnity also make great add-ons. All these products can be sold as a standalone or bundled together. When your customers purchase their Allstate Health Access plans through a Life Association membership, they get access to special programs and savings that can positively impact their day-to-day lives. The Life Association is a not-for-profit, members-only organization which provides members with lifestyle-related benefits and discounts. Members will get access to Telemed for Life. This is an innovative solution for non-emergency illnesses and general care. It provides members with direct access to consult with state-licensed physicians via phone or video to treat common ailments and offer healthcare advice, 24 hours a day, 7 days a week. There are no additional costs or limits on the number of consultations for members. When needed, physicians can call in prescriptions as long as they are non-narcotic. Life Association members can take advantage of the Active and Fit Direct program, where they can choose from over 12,200 fitness centers for just $28 per month, plus any enrollment fee and any applicable taxes. They can also access over 9,300 on-demand workout videos for use in their home or while they are on the go. Members can also receive a variety of other services and discounts, including hospital and diagnostic facility negotiation services, discounts on services from Direct Labs and Lifeline Screening, access to the Financial Empowerment Platform, comprehensive identity and credit monitoring from Allstate Identity Protection, with $1 million of identity theft expense coverage and $500,000 in stolen funds reimbursement. Offers for auto discounts with new and used auto quotes, new car purchase assistance, auto repair and maintenance discounts, and discounts on tires and wheels. Offers for entertainment discounts on hotel and resort stays, car and RV rental packages, and theme park admission, along with a variety of other savings on movie tickets, retail stores, and gift cards. It is important to note that Life Association membership benefits may vary by state. Lifestyle and wellness benefits and discounts are not insurance. The agent and Allstate Health Solutions may receive financial compensation in connection with membership fees. Let's discuss Allstate Health Access's plan details, including eligibility requirements, state availability, discount rates, limitations and exclusions, and enrollment and payment options. To be eligible for an Allstate Health Access plan, your customers must be between the ages of 30 days and 64 years at the time of application. Dependent children can stay on their parents' plan up to age 26. Child-only policies are available for kids who are 30 days old through 17 years of age at the time of application. Health Access policies are renewable to the month that a customer turns 65 years of age. Customers must fill out a health history questionnaire at the time of application. It is important to note that customers must answer all underwriting questions honestly. Any false, inaccurate, or misrepresentative statements on the enrollment form may result in claim denial, premium changes, or contract rescission. Allstate Health Access is available in the states shown on your screen. We are always adding states and new products to our portfolio, so remember to read your broker alerts for the most up-to-date information. Your customers may be eligible to receive a discount on their Allstate Health Access premium rates. If they purchase an Allstate Health Access plan along with an ACA plan, your customers can receive a 10% discount. Additionally, If your customers purchase an Allstate Health Access plan during open enrollment, they can receive a 10% discount. These discounts can be combined for a total discount of 20%. Discounts remain for the lifetime of the policy. Allstate Health Access does have some limitations and exclusions. Some examples of these limitations and exclusions are currently shown on your screen. Please keep in mind that this is not a comprehensive list of limitations and exclusions. Refer to the product brochure for a more comprehensive list, but always refer to the policy contract for a complete listing. Your customers can enroll in Allstate Health Access on any date, and their plan's effective date can be as soon as the next day. For their initial payment, customers can choose any date between the time of their application and before their plan effective date. Reoccurring payments can occur between the 1st and the 28th of every month, and acceptable forms of payment are EFT, Visa, MasterCard, or Discover. Allstate Health Solutions has some great resources and tools to help our agents with their process, and we offer useful resources for our members too. Our website, www.allstatehealth.com, is a one-stop shop for you as an agent and a resource for your customer. On our Agents and Brokers page, you will be able to access agent tools, such as your agent back office, Coverage Builder, which is your quoting engine, and our YouTube page with training videos on all our products. Explore our coverage options for individuals, so you can help your customers choose the right coverage to meet their needs. Find information about working with Allstate Health Solutions and starting to build your portfolio. And view and download marketing materials, such as the most up-to-date plan brochures and flyers, along with our state availability grid. On our existing customers page, we offer places for your customers to find a provider, view general policy documents, submit claim forms, and access their member portal. When enrolling in Allstate Health Access or any other plan from Allstate Health Solutions, your customer must review the application and billing authorization and provide an e-signature attesting to their underwriting. Customers who complete their application on their own do this during the application process. Customers who agents assist through the application and submission process must do this via the member portal. As soon as the agent clicks Submit on the application, the customer will receive an email or text message containing a link to their member portal at www.myallstatehealthsolutions.com. Here, they will review their application, billing authorization, and e-sign. When the customer logs into the member portal, they will be prompted to read the authorizations and provide their e-signature as verification. The process will take customers just a few short minutes. Members can also view all their policy documents and plan information, check current and past payments, as well as their current payment method, and download temporary ID cards through their member portal. When discussing Allstate Health Access with your customers, remember to make sure that the information currently shown on your screen is clear to them. Allstate Health Access is a strong product to add to your portfolio. Just to quickly recap, Health Access provides your customers with set dollar amounts to help with healthcare costs. There are 4 available benefit levels, including guaranteed issue, so your customers can choose the right plan for their needs and budget. Health Access plans have no waiting periods for injury and sickness benefits. With predictable, set payments and premium rates, Health Access plans are easy to use and understand. Your customers can choose to go to any doctor or hospital, and they can save even more by staying within the First Health network. Finally, there is no lifetime limit. All Health Access plans pay the maximum benefit amount every year your customer owns their plan. So, why Allstate Health Solutions? Allstate Health Solutions has roots dating back to 1939. We have received an A+ rating from AM Best, indicating that we are financially sound. Additionally, we are specialists in both short-term medical and supplemental insurance plans. If you have any questions regarding Allstate Health Access or about becoming contracted with Allstate Health Solutions, please contact the email address on your screen. Thank you for your time, and have a wonderful day.